When someone is seriously injured, time is of the essence. It's vital that the patient is taken swiftly to the right place for expert treatment. Each year, around 20,000 people are admitted to emergency departments in England with serious multiple injuries. Good trauma care is vital to their survival, but just as important in their recovery is specialist rehabilitation, starting within 48 hours of admission.
Well, I think from a neurosurgical point of view, it's all well and good having patients admitted after serious trauma and doing the initial operation, which may save the patient's life. But if you can't return the patient to their occupation, to their family, to their normal life, then there has been little point in doing the initial intervention.
This is the neurotrauma handover meeting where the detail of recovery is discussed. Dr. Ganesh Bhavikati is one of 4 rehabilitation consultants at the Walton Centre.
With the new advancing medical field, with the new knowledge, we are saving a lot of patients out of the critical illness. However, it's not just saving the quality of life coming with their optimal recovery, and rehabilitation improves their quality of life by enhancing their integration back to their society.
The new specialised rehabilitation service for Cheshire and Merseyside has transformed the care of these patients. For the first time, the different stages of rehabilitation treatment are joined up and coordinated by a central team based at the Walton Centre. Also at the Walton Centre, there is now a hyperacute rehabilitation unit for patients who are still at a very early stage of recovery and may still have a tracheostomy. Rehabilitation at this stage is available in only 4 hospitals in the country. As patients recover, they're moved into a specialist acute rehabilitation unit in the Walton Centre. And as they improve, they go to one of 3 specialist subacute rehabilitation units at the Royal Liverpool and Broad Green University Hospital, St Helens Hospital or Clatterbridge Hospital. From there, they usually go home. For some patients, the next step is into specialist extended rehabilitation care at Oakvale Gardens in Old Swan, Liverpool. Once home, the patient will receive specialist rehabilitation community services, all coordinated by the network. The result is that patients are recovering more quickly and with better outcomes, and they are getting home.
We have a hub and spoke model. We concentrate the expertise with the really complex rehabilitation patients in the hub, which is at the Walton Centre. That's the centre of the whole network, and the most complex patients with the most complex needs are looked after here, and then as they get better and their complexity decreases, their condition improves, they can then often be transferred to other rehabilitation units which we have set up as the spoke units. We are doing very well at the sharp end, so to speak. Patients are surviving in increasing numbers, but of course that survival, the quality of that survival is so important. And we know that with the most modern rehabilitation techniques, we can improve patients back towards their previous level of functioning much better than we ever could 10 years ago, 5 years ago, perhaps even, in our case, 1 year ago.
Bethany Rogers was at university when she collapsed with a brain hemorrhage, suffering serious brain damage. Bethany's parents were told to prepare for the worst.
She was just hooked up to machines. They'd shaved a big chunk of her hair off to put a drain into her head to relieve the fluid on the brain because the bleed had happened at the very back of her brain.
Just 9 months later, she is on her feet, a huge achievement for her and the clinicians. But her balance and speech have been compromised.
Can you see my fingers? Can you follow my fingers?
One of the strengths of the network service is the availability of input from dedicated psychologists and psychiatrists. And it means that Bethany can return to the lecture hall and beyond.
My goal is going back to uni, meet the people, and mentor the group. Take classes with them and I miss my promise, even though they deliver get in a mess. I want to go to Australia. First wanted to go. Be nice. Yeah.
Bethany's parents know they're a long way from where they would have been without the specialist rehabilitation care. Bethany has now returned home and is continuing to receive physiotherapy and occupational therapy in a community setting. She's one of many patients benefiting from a new, integrated pathway of care which is seamless, from hyperacute through the different stages of complex acute, subacute and slow stream specialist care to care provided in community settings. The road to recovery in Cheshire and Merseyside begins early and is coordinated through every stage to give patients the best possible outcome.